Hello everyone, Dr. David Kulla here with Synergy Wellness in New York City. If you have neck pain, you're going to want to watch this video. There's a lot of different things that we can do for neck pain. We have Samantha here. We did some cupping on her. You might see a little round circle here, probably not from there. But, you know, we did some cupping on her to loosen the muscles up and to pull some of the lactic acid to the surface of the skin where she has more capillaries and she can get rid of that lactic acid. But she still has some soreness here. So these are one of the things we could use. It's a Graston technique or an IASTM, instrument assisted soft tissue mobilization. But we're not going to do that for her because she tends to be pretty sensitive when we do muscle work, physical muscle work. So we're going to use our next best weapon. This is incredible when it comes to muscle spasms, soft tissue inflammation, trigger points, tears in the muscle. I mean, this does so much. It's cold laser therapy. This is the MR5 Active Pro by Multi Radiance. This one has laser stim in it. So with that laser stim, what I'm able to do is find areas of inflammation. So we're just going to scan her neck and find those areas of inflammation. And it also tells me how long to dose the area. It kind of takes the guesswork out of everything. I'm going to just scan her neck. And you might hear a beep. Some of them are false alarms. I'll let you guys know which one's a false alarm. Because of the sensors, if you lift it slightly off the skin, it will beep and tell you that it's a false alarm. That was not a false alarm. So that's right over her levator scapula muscle. So we're going to dose that. And again, it'll tell me when to stop, when it's finished dosing that area. And oftentimes we'll run the laser over the same spot multiple times because we want to make sure we knocked out all the inflammation in that area. So sometimes it will dose an area twice. And it uses an impedance meter, so it's able to send a stimulation through the soft tissue and measure how long it takes to come back. And if there's fluid or inflammation there, it will take longer. So that's how this works, and it's uncanny. I mean, it finds those areas of inflammation. I had a guy with tennis elbow, lateral epicondylitis, and you know where it's gonna beep. Over the lateral epicondyle, and there's no way to tell the machine what you're doing. And I scanned the entire arm, and sure enough, it beeped right over those same spots. So it's very, very accurate. Oftentimes, though, I don't need this this laser stim or the scan because I know where the areas of inflammation are. So now it's done dosing, so we're going to lift it off the skin and reset it. And we're going to scan the neck here. There we go, another spot. It does so much. You can use it for so many different things, everything from carpal tunnel syndrome to sprains and strains to just neck pain or arthritis, whether it's in the neck or whether it's in the knee. It doesn't matter. It's very effective for arthritis. Do you feel anything, Sam? Yeah. And that's the other beauty of this. You don't feel a thing. Just feel the emitter on her skin, that's it. It's been dosing this spot for a while, so it tells me there's quite a bit of inflammation here. That's where the pain starts, right here? Okay. So how bad was your neck pain on a scale of 1 to 10, 10 being the most prior to me starting this?
I give it a 7.
7 today, okay. So we're of course going to adjust her cervical spine, her neck, and her thoracic spine after we do this laser. This is the supraspinatus muscle that it beeped over. So a lot of us get pain across the top of our shoulders, and oftentimes it's not just the trapezius, it's actually the supraspinatus. So you see my elbow here and at my side? The second you start pulling your elbow away from your body, from the side of your body, just 10 degrees, you start to contract that supraspinatus muscle. And a lot of us pull our elbow away from the side of our body on our keyboards or on the mouse. It's a big mistake. So if you get a lot of pain into the top of the shoulder and let's say it's one-sided, it's always on the right side, and that happens to be the side that you use the mouse, then you need to reassess and see how you're using the mouse. Maybe you need to get a mouse with a trackball so that you don't need to move your elbow around when you're using the mouse, you just move your thumb. That's a good solution. Maybe it's the left side and you don't use the mouse on the left side, so then maybe that's how you're putting your hands on the keyboard, right? So you just want to pay attention to those things. Again, you want your elbow in at your side. You do not want it away. 10 degrees away from the side causes contraction of that supraspinatus muscle, which will in turn cause neck and top of the shoulder pain. So the timer ran out there. We're going to scan that area again. She had some pain in the front of her neck, right there, and there it beeped right over that spot. And that's the SCM, sternocleidomastoid muscle. These are all long names. You don't need to memorize them. The SCM muscle attaches into the bone right underneath your ear, called the mastoid. And that can oftentimes get really tense if you have TMJ pain. Oftentimes we find the SCM muscle tight, or if you're working on a computer all day with your head down, or you're on your cell phone all day, the SCM can get really tight here. And let's see how long we dose this area for. So as you can see, she's got some inflammation in all the areas up at the top of the neck, at the base of the neck, at the levator scapula, the supraspinatus muscle, and the SCM muscle. What we'll do is, she said her neck pain was a 7. We'll check right after we do the laser, see how she feels, let her move her neck around, and we'll try to give it a number at that point, and then we'll adjust her, of course. The most powerful thing is the chiropractic adjustment, but this laser is no slouch compared to the chiropractic adjustment. It's a really powerful tool and a very, very effective tool. So if you have neck pain, or have had neck pain or back pain, or a condition that you just can't seem to get through, whether it's through physical therapy, chiropractic, or a mixture of both, and you seem to have plateaued and not really gotten any better, this might be the answer for you. Me in particular, I had an accident back in April of last year, and chiropractic helped me immensely with my neck pain and my headaches, but I'd say about 70%. There was still that 30% left, and I wasn't getting better. And that's when I started using the cold laser, and I was able to get to 100%. So it's certainly a viable option for those of you that suffer from chronic pain and can't seem to get relief from just traditional chiropractic or physical therapy. Okay? How you doing so far, right? Okay, we're almost done. And I'll show you folks how we adjust her cervical spine, how we adjust the mid-back for her. She's on a computer all day, so because of that, we're finding some anteriors, some misalignments in her thoracic spine in between her shoulder blade area. This area seems to be real inflamed.
That definitely feels like the center.
From the front to the back. And one last spot here. Okay, so while the laser stim is really effective in pointing out the areas of inflammation, and a lot of times a practitioner may think there's only inflammation in one specific spot. So this really helps the practitioner be able to scan the whole region and catch any areas that he or she may have missed. Now, I have never seen another laser, cold laser, out on the market that does that finds areas of inflammation and soft tissue damage. This is the only one that I know that does that. Okay, now move your neck around and see how that feels. How are we doing on a scale of 1 to 10? Can you give it a number?
I gave it a 7 before. I give it
A 5 now? Okay. All right, so let's have you lay down on your stomach. Okay, so as I said here, folks, she has a lot of anteriors, which That means the vertebra is shifted forward in towards the body. And the best way to adjust that is not face down, but actually to have her sit up, so or turn over on her back. So I'm gonna have you turn over on your back, and then I'll have you slide down a little bit, okay? Yeah. Okay, cross your arms in front of you. Good. Take a deep breath in. Good, and blow all the way out, Sam. Good, and another one. Deep breath in. And blow all the way out. Good. All right, 2 for 2. We got a lot of movement there from her thoracic spine. And what that does is the adjustment helps to realign the spine and take any pressure off irritated or chafed soft tissue or even nerves. Relax yourself here. And sometimes she gets some chest pain as well, which is a little bit of costochondritis, where the ribs meet the cartilage. Relax here. And those ribs wrap around the back and attach to where we just adjusted her. So do you have any chest pain, or have you had it in the last few days?
Are you guys gonna?
Yeah.
I couldn't hear you with the crinkling.
Any chest pain?
Not currently.
Okay. So when it really flares up for her, she gets that chest pain, and relax here. Good. Were you having a headache?
Yeah.
Yeah, so she had a headache, and I noticed right up at the very top of the neck, C1 was out of alignment. If you suffer from headaches, go see a chiropractor. It's one of the easiest things for chiropractors to address and get to the cause of. She doesn't get too many headaches, right? Just from time to time, when things get bad. And again, she gets some chest pain on the upper right-hand side, and that's associated with the middle spine being out of alignment, because those ribs wrap around and attach to the sternum, wrap around to the back and attach to the thoracic spine. If you guys have any questions, feel free to comment below. I appreciate you watching, and make sure you hit that thumbs up button, and of course, don't forget to subscribe. Thank you, appreciate you.